When I went through medical school, it was really obvious to me that I wanted to do orthopedic surgery. There's something about orthopedics that it's very tangible. In other words, I get to fix people. I get to, if they're in a wreck or if they tear their ACL playing football, I get to fix them, restore them to normal, and it's incredibly rewarding and fun for the patient and for me. And it's very unlike other subspecialties which don't have that luxury. The thing I love most about orthopedic surgery is there's this weird connection between a patient and the surgeon, and it's sometimes it can be stressful, sometimes it can be very fun, but at the end of the day, it's beautiful because that patient puts their trust in me, and I do my best to fix them, and to be able to fix people is really, really rewarding. So the other day, we were standing in the OR and I was working with the group of same people that I work with every day. And the patient was about a 55-year-old male that worked in the mines and had torn his rotator cuff, had an injury, and he wasn't able to work. And we had this beautiful moment where all of us looked around the room, and sometimes, quite frankly, we forget what we're doing. It's something we do every day. And we just had just a second to appreciate, hey, this is really cool. This guy's gonna be able to go back to work, and it's gonna make a huge difference in life. And it was just one of those beautiful moments. I loved the time I spent working with the Padres and working with the Sooners and other professional and collegiate teams. But at the end of the day, that was a part of my life that I really enjoyed, and it was super fun. But at the end of the day, what I really like doing is just taking care of people that need the help. And that's a lot more fun for me. Traveling to different communities is challenging for sure in terms of just in terms of transportation, getting back and forth, particularly in the winter. But it's definitely, I make up for it and how much fun I have. Being able to work with patients that need me, being able to work with patients in small towns like the one I grew up in is incredibly rewarding, and it's definitely worth it. I love my time in Denver. It was a wonderful experience and I enjoyed the things that I learned there. But at the end of the day, I really yearned for something more. And I miss patients like the patients that I grew up with. I grew up in a small town in Southeast Texas, and I miss that environment, and I wanted to get back to something that would recreate that. And so far it's been wonderful. I get to work with people in small communities, and it's been a wonderful experience.